Just 2 days after the World Health Organization declared monkeypox a public health emergency, there's growing frustration among local healthcare professionals that enough is not being done to prevent a widespread outbreak. News4JAX anchor Tarek Miner is joining us now after speaking with a local doctor about the rising number of cases. Tarek.
Doctors are calling this a rapidly escalating outbreak with cases detected now in 44 states, including Florida. Over the weekend, 2 U.S. children, a toddler and an infant, were diagnosed with monkeypox, showing just how contagious it can be. Until now, monkeypox cases have been concentrated primarily among those in the gay community.
We know the playbook of how to stop this, and unfortunately, it's not happening.
UF's Director of Infection Prevention, Chad Nielsen, expressing his frustration about what he calls impediments we're seeing in Florida to combat monkeypox. Nielsen says there seems to be confusion on testing and where to submit yourself for exposure notification, along with a lack of information about obtaining the vaccine.
I'm told by our local FDOH Duval County counterparts that they do have some, and they are prepared to deploy it for folks who have been exposed.
News4JAX has learned the state of Florida has received about 25,000 doses of the monkeypox vaccine from the White House, with an additional 10,700 doses requested. Only people who are considered to be at high risk for infection are able to get the shot. Monkeypox is a rare disease, which doctors say is similar to smallpox, with symptoms of fever, headaches, muscle aches, and a rash resembling pimples with pus-filled blisters. The rash can develop all over the body, including face, feet, hands, and even inside the mouth. Monkeypox has infected nearly 3,000 Americans so far, and according to the CDC, Florida has reported 180 cases. Doctors say 98% of the current cases are among men who have sex with men. But Nielsen says it's not a sexually transmitted disease, but instead one that spreads by contact.
We like to compare it to MRSA. So years ago, we used to hear about MRSA, MRSA outbreaks amongst like high school football teams because they were sharing razors or sharing towels or sharing other items between each other that had close contact to their skin with sweat or body fluids on it. That's what we're talking about for monkeypox spread at this point.
Close contact in clubs while dancing or even sleeping in someone else's bed can lead to a monkeypox infection. While Health and Human Services Director Xavier Becerra says America is ahead of the disease.
So we have to stay ahead of it, and that's what we've been trying to do since day one.
Nielsen says the disease is spreading at an alarming rate.
For people in my field, it's very frustrating to watch this happen. I think that we didn't learn a lot of those lessons from COVID. We have been sluggish on testing, sluggish on our response with vaccines, sluggish with public health announcements to the at-risk communities.
Now, one of the most asked questions on news4jax.com is why is it called monkeypox and where did this disease originate from? Well, monkeypox was first discovered in colonies of monkeys used for research back in 1958 in Copenhagen, Denmark. The first case detected in humans in 1970. Here locally, there has only been one confirmed case of monkeypox in Duval County so far.